In this video, let's talk about how we perform a Chiari decompression. Once the decision has been made to undergo surgery for a Chiari malformation, the patient's taken to the operating room at the day of surgery and undergoes general anesthesia. The surgery is done with the patient face down in pins. So it may be surprising for some patients that they have maybe a staple in their head. Well, we hold the patient's head in pins to keep it very still and positioned just the way we want. The incision is in the back of the neck, and it goes up to a bony prominence kind of on the back of the head. And then the lowest part of the incision is at about C2, which is the highest bony prominence of the spine that you would feel on the back of your neck. So the incision is in the back. We cut down right down the middle to the bone of the back of the skull and to the back of C1, which is the top cervical vertebrae, and it's actually like a ring. So the back of the ring of C1 and the back of the skull. Once that's done, we make a cut in the bone, and we usually remove about 3 centimeters of bone on the back of the skull. And it's a thin area of bone, and it's tucked up underneath the muscle. So if you were to feel the back of someone's head that has had a Chiari decompression, you may not actually feel where the defect in the bone is. And then we'll also remove a little bit of the ring of C1. I try to preserve the ring, but only take a little bit of it so that we have a bit more room to decompress the Chiari malformation. In some cases, we may have to remove the whole ring of C1. We then go under the microscope and we open the dura. So the dura is the covering of the brain. And we open it and we stitch it back. And then we dissect the arachnoid bands, or what they're called, so that we can really carefully and easily see the cerebellar tonsils. So the Chiari malformation involves the back part of the cerebellum, and it's descended down or herniated down into the spinal canal. And the part of the cerebellum that's herniated is the cerebellar tonsils. So we'll identify those. Sometimes we'll shrink them back so they're not descended down as much, or remove them. Once that's done, we make sure that the brainstem and the spinal cord are completely free of any arachnoid bands or pressure or anything else. And we irrigate any blood products away from the spinal fluid. And then we sew a patch of collagen that creates what's called a duroplasty, which is basically to enlarge the covering of the brain so that there is more room for the contents that are in that location. We sew that in watertight. We like to check to make sure there's no spinal fluid leakage once the patch is sewn in. And I sew the patch in under the microscope. Once that's done, we close the wound. The patients are usually in the ICU for a night and maybe on the floor for a night. The main postoperative issues really are pain from the incision and muscle spasm, and then nausea. So we try to treat the nausea with some really good anti-nausea medications and manage the spasms with other medications that hopefully don't cause nausea. And then the recovery period is about 6 to 8 weeks after the surgery. In my experience, if the patients are well selected for Chiari decompression surgery and the surgery is done technically well without any significant intraoperative problems, the patients do well and can have good results from the operation.